disappearing or behaviour that wasn't there appearing. Now, the saddest part to this story is when you've got very young dogs who might have been born with hip dysplasia or elbow dysplasia in the terms of arthritis, a lot of these owners don't have a behaviour that they can relate back to. I saw that recently where I've had a very young Labrador in with us, and I just want to give him the biggest medal ever, give her the biggest medal, because her demeanour is incredible for the disease that she's got. She's got significant arthritic change in both hips at the age of 6 months. Like, they look like a 10-year-old's hips. And her elbows are pretty stuffed too. And she is coping with life the best she can. But when you compare it to what another Labrador would be doing, and the cheekiness and pushing the boundaries, not there. But that poor owner didn't have anything to relate to.
No.
Behavioural change is great when you've got something to relate to.
Yeah, exactly.
Let's now talk about some classic behaviours if you haven't got.
Just a couple of those points, Hannah. The lady with the Westie. I think one thing we've got to be consider about is, hang on, I'll start that again. One thing we ought to and it is a really important point, that dogs are not functionally developed. In other words, their anatomy is not developed for our environment.
No.
That is a key point. So if anyone says, oh, am I spoiling my dog? Well, actually, we're expecting our dogs to live with us in our environment, and they're not built to do it. So anything we can do to help that, and I know that's your and my passion, number one, flooring, but stairs are very much part of that. You don't see a David Attenborough,
the wild dogs through,
walking up and down stairs or whatever. So that's one thing. Point of reference, again, for someone like your puppy that you're talking about with behavior, I think something that I encourage people to do, and maybe this might work for a young dog that doesn't have that point of reference for behavior change necessarily, is actually, I like to get a picture, a photograph, a side view photograph, and perhaps just put it on the fridge or any surface that is easy to look at and relate back to, because postural changes are insidious, like behavioral changes. And if we can look at how our dogs used to look, then we can quickly see some changes. Oh, not.
But we're going to come to posture next. We're going to do behaviour, then we're going to go to posture, then we're going to go to physical.
No, I don't want to, you know.
Don't jump the gun, Julia. Just don't jump the gun.
Sorry.
So for the people that are like, oh my God, I don't know if I would detect a change, what are behaviours that I need to be aware of? So let's just run through a few things that I must admit opened my eyes back in the days that you were teaching me. As say, choosing to take yourself away. You know, generally dogs are very social animals. You know, that's what we have them, and we've had them for 33,000 years. They're social animals. So that would be something. What would you say? Let's just do a quick fire.
Taking themselves away, yeah, definitely. The other thing I think is really quick to for people to realize is that they are avoiding you touching a particular area, or openly pushing you to touch and make itch an area, that itchy spot on their back. Oh yes, they love that being itched. Well, that is not necessarily a good sign. So places that they're avoiding and places that they are encouraging you to actually manually influence, if you like.
Yeah, I would say things like compulsive. So I learned a lot from Holly. I wish I'd known what I knew now, because I think I would have attended problems a lot sooner. But she would lick furniture or her bed. And that compulsive, just losing herself in a repetitive behaviour pattern, I now know was her saying, I've got bilateral sciatica and it really, really hurts. So that's another one. I would say things like becoming less tolerant. So
totally. But
Yeah.
going back to the licking is, I would consider that more advanced discomfort when a dog perpetually, or not even perpetually, but licks their feet or legs or part of their body regularly. And that regularly could be 5-10 minutes every evening or in the morning, but people tend to notice it obviously in the evening more, or hear it. And they hear, and it actually can become incredibly annoying. And people start saying, "Oh, stop licking." But that is quite an indicator. So that's a big behavior. And chewing parts of their body too, either legs or, as I said, parts of their body, back, lower back. Definitely that sort of redirecting or trying to address. I mean, we don't know what it is. I know that I get pins and needles when my neck is bad. I know I get pins and needles and sometimes a dead hand. I shake my hand or I itch it. I'm assuming that could be similar to what a dog might do in relation to licking or chewing their feet. So that's definitely something that can be noted.
And another one for me would be less tolerant to being picked up, to having wiped. I'm quite excited. It isn't ready yet, but hopefully in about 3 months we're going to be releasing a children's book. It's a bite prevention book, trying to get children to be much more aware of the discomfort that the arthritic dog in the household might be in, and therefore to give them a wider berth and treat them with care. So watch this space. It's been beautifully illustrated by a lovely guy called Phil, who's doing it all for the kindness of his own heart, which is amazing. I think that's something that I would really like people to kind of go, oh my God, my dog who used to be the best, funnest person in the place has now become a bit tetchy about simple stuff.
And the other thing, I think a big area that we can overlook is how they sleep, their sleep behaviors. Now, we all know that dogs sleep a lot, and they've got to sleep a lot. They need many hours of sleep. So, of course, like me, again, I relate back to myself. I have to sleep with a decent pillow, and I have to move that pillow all the time to support my neck. So dogs adjust their sleeping position and where they sleep to become comfortable. So again, sometimes these can be a bit confusing, these indicators, but dogs that hang their heads off things like sofas or out of their beds, that can be an indicator. I always offer dogs a pillow, and if you always see them lying with a pillow under their neck or under another part of their body, that could be an indicator too.
And then on the sleep front, dogs that aren't settling, so they get up and they reposition themselves.
The dogs that might go round and round and round before they can settle, or move when they are fidgety, or the big one, they groan when they lie down. It's a bit like, I find myself involuntary moaning and go, oh, as I sit down. Then no, I've got to stop. That's just old. But they do similar things like that.
And another classic one will be a dog that's always sat with you on the sofa, and it's now like, I'm going to get off the sofa when you get on. I'd rather you weren't near me. That's a big one.
That's another one. So as you said it front on, it's about looking at these changes. The problem is that they are so slow, aren't they? They are insidious. They don't generally happen overnight. They creep in, and so it almost becomes an idiosyncratic behavior of that dog. So we don't question them because, oh well, they've always done it, have they? No,
and I think even more than that, I know, and this is no disrespect to my family and friends, I think a lot of people play down change. So I would be like, oh my God, Holly's doing this or she's done that. And I have to phone you and I'd be like, there's something different going on. And I know that depending on who I would have talked to, they would have quite often said, oh, Hannah, it's just age. And I would then lose the confidence that it had any value. And I would be saying to myself, oh, no, they're right. It's just age. I'm just seeing things. that we've done you this sheet, which, as I say, there will be a link so that you can go and write down your findings so you can have it presented to yourself, because by the end of tonight, we've still got to do posture, physical changes and capability changes.
Yeah.
You have this washing machine in your head of, oh, could this be? Oh, could this be? Oh, could this be? And you have to say to yourself, right, let's write it down and let's look at the bigger picture. Now, when me and Lindsay and Danny from the CAM team teach, we talk about the CAM factor. And I know now that I have the confidence, if somebody reports to me a change in behaviour, posture, physical appearance, I am confident to start talking about pain. I have no problem. But when you're new to this field, if you're ticking, yep, there's a behaviour change, yep, there's a posture change, yep, there's a physical change, I've got 3 out of 4. There's a problem. It's a confidence boosting tool as well. So behaviour is really one of the first things that tells you there's something going on. And as the dog owners, as the dog carers, as the dog advocates, we're often quite slow to pick up on that one. We tend to wait for them to give us something a little bit more hardcore to handle, such as the limp, such as the difficulty. Let's move on to the next subtle one, which for me was a real eye-opener when Julia started talking to me about this. And I know where my jaw dropped. Can you remember what one it was? Anal glands?
No. You know, Hannah, you did that a few times. So
anal glands. I can remember you turning around to me and saying, why does a dog develop anal gland impaction problems later in life? You know, and I was like, food allergies. It's all about food allergies. It's about infections. It's about a change in the feeding regime. There's absolutely no way. And then you said, well, if they get dorsal pelvic tilting because their back legs are weaker and they're arching their back, and therefore the whole kind of rectal passage changes. So therefore, when they go to poo, there's a potential that they're not actually compressing their anal glands and emptying them. I was like, oh, I'm not sure about that. But it's, yes.
Yeah.
Yes. So let's talk about posture.
Yeah.
You can take the lead on posture.
Posture, okay, well, posture is an effect. We all change our posture to react to guarding muscles. So guarding muscles or guarding is when we guard an area that is uncomfortable. So a lot of us have problems in our neck and our shoulders. So we actually end up being quite tilted in human form. Now, exactly the same with dogs. They have to guard areas and they have to shift the load to accommodate movement. So by shifting the load, they then overload different areas and underwork other areas, and quite often they work diagonally. So you get this stronger diagonal. But what also happens in the meantime is that always the neck is affected. So quite often the neck comes into the shoulders. When the neck comes into the shoulders, everything impacts on the lower back too. So everything moves around and shifts and basically becomes shorter. A postural change, in my experience, becomes shorter. So the neck moves in, the back quite often can roach, and then you're getting this pelvic tilt.
Go towards your oven. You're drifting, love. You're drifting. Get your oven, love.
Go here, back here.
Perfect. Stay there.
Yeah. Right. My posture is awful at the moment because I'm sort of twisted round the table leg. But by the posture changing, it's going to have an impact everywhere. So you will see the orientation of the feet will change. So it goes through the whole body. It goes to the head carriage. It goes to the tail carriage. It goes to the top line. It goes to how the feet are placed, how square or not square they are when they're standing upright. So a postural change can be quite small, and it can be massive and go literally from nose to tail.
Yeah. And so my little tips to add to this, okay, is that I questioned this a lot in the beginning. I because we have such big breed variation. So I'm going back to First Opinion Vet 2015, and I was listening to this crazy lady in Bolney, and I was taking it back to my workplace and just going, no way, this isn't making sense to me. I've got from a French Bulldog to a Great Dane, you know, they're different body shapes, they have different behaviors. How can I bring this all together? So some tips that really helped me is you're looking for a consistent postural change. And in moments of arousal where there's distraction, they will bypass that postural change for a moment, for a fleeting moment, and then they'll come back to this adapted postural change. So be prepared for it, because that will put doubt in your head. You go, no, he was fine for 30 seconds then, so it's not a problem. You'll be amazed what the neurochemicals of the brain can allow the body to do. And then when they go, you go back into your coping posture. Other things that I really needed to kind of like cement in my head is, as I say, there's quite a big breed variation. So you're looking for things that just don't look right. So let's just talk through Holly. Holly was a collie. Holly, she was a vibrant dog. She was agile. She was nimble. She had good placement skills. So when her back started to take a slight roaching, which is just before the pelvis, they just get a bit of arch, and her tail then started to drop. And she didn't have that expressionate tail. Quite often it was held low, and it got to the point that it was held almost vertical, and it got to the point that there was very little tone a lot of the time. She, posturally wise, she used to stand square, and she was proud and she was majestic, and she's then started having her back legs placement would be a silly posture. She wasn't stable. So if you asked her to stand, you'd expect her to stand like a table. And she started taking a bit of a wonky table. So one back leg would be nearer the other one, which wasn't very stable. She'd get the wobble. So that was something else. Her neck carriage, she used to be into everything. You know, she'd be like, what's going on around me? And then it became very neutral. And she'd turn with the whites of her eyes rather than actually twisting her head around with ease. So those sorts of things, I think it took me quite a while. So I'm going to be honest, you guys, you know, it takes a little bit of time because there's so much doubt in our heads. And there's so much, you know, no, I'm just seeing things. Write it down. And as Julia says, a really good thing that you can do, and I know a number of dog trainers do this, I've seen them do it, is they take photos of their dogs from the side and from above, and they do it maybe once or twice a year, so that they can notice change. And something that we were hoping that a lot of vet practices might start doing is buy those weighing scales, have a white wall and have a black grid. And when that dog stands on the weighing scales, take a photo, because weight is best managed looking at it visually, palpating and the number, but posture as well. You can really pick up on changes on a white background in just a lateral view and having a few little reference guidelines there. So posture, what else can you add to that?
Well, add to the posture. I think really it's with the posture too, things that the mobility will change along with the postural changes, because of course, if your muscles are not functioning how they should function, you are going to find different actions difficult. So it may be at the same time your dog doesn't sit anymore voluntarily, or because I really don't like dogs being asked to sit excessively. I don't understand why. It's an extreme movement. So if they're a little bit stiff, or their shoulders are sore, or their neck sore, to ask a dog to sit and stand is going to be very difficult. So that posture will really impact on certain actions, and the sit is definitely one of them. In fact, once their posture changes, all sorts of movement will change, obviously, because they are going to be compromised. But I think before they go into those postural changes, maybe before we see anything too radically different from a physical perspective, we might notice that they might preempt things differently. They might not want to jump over something rather than go round something. So they might start before, as I said, the posture really starts to take hold. They might be just avoiding different actions and different activities. And that is something that is a really important early pointer before we go too far down that line. Does that make sense?
That's really, yeah, I love that, because you do quite a lot of work with agility dogs, and I'm beginning to do so with the nature of my new job. And I am dumbfounded with the level of competition that border collies can still be doing, even when they're carrying significant amounts of discomfort. Everybody knows I love dogs more than people. I'm turning into a complete hermit, and they're amazing with what they can actually tolerate, cope, get on with life with. So when we make these changes, let's not just brush them under the carpet. They signify that there is something pretty significant going on underneath. So postural changes, as Julia says, it's not just about sitting, it's about laying.
The other thing, oh, sorry, we're talking over
No,
sorry.
Go for it.
The other thing I was going to add was dogs can become clumsy. Like we become, I know when my back is not good, I tend to not be very spatially aware. And that, again, seen in dogs a lot. When they are uncomfortable, they can become clumsy, a bit almost the opposite to the puppy that hasn't appreciated that they've grown and spatial awareness hasn't quite caught up. And dogs can become quite clumsy.
That's really true. Like I've got a few pain problems at the moment, because I do a lot of driving. So I'm in a sat position, or if I'm at my left, I'm sat. So my hip flexors are very contracted at the moment, which has now switched off my bum muscles, and my hamstrings are pretty crappy, and my quads are now really tight. And basically, bending down to pick things up, I'll go to pick it up, and I might actually miss. So if I drop something on the floor, I'm only 41. This is really bad. And I go to pick it up, because my body kind of says no. I don't coordinate so well. Shut up, Julia. Just shut up.
I've got to see that. I'm going to set you up for that.
I'm going to start filming my difficulties in life for you. It'll become a case study. So yeah, posture, as I say, when standing, postural change. When moving, postural change. When sleeping, postural change. Holly would always sleep in like a half moon shape. And I was like, what's that about? And that was her saying, I've got lumbosacral disease, and this takes a little bit of pressure off my spinal nerves as they come out of lumbar vertebrae 7, S1 region. This gives me some relief. So looking at if they change the way that they sleep. A classic one for knees is that when they go into a sit, they leave their legs stretched out and they sit on one bum cheek. Don't fold nicely under in a ready, as Julia was saying, for the ability to get away quickly. To a side. So things like that are really important. So let's move on to now physical changes. And you know the story I'm going to tell everybody. Do you remember it?
Again,
the dissection. Do you remember that? Okay, so this is probably about 4 weeks into lectures, and Julia drops the social hand grenade that the coat will change. Now, I had a lot of dermatology lectures at university. We covered the coat and the skin in quite a lot of detail. And to have somebody tell me that I will see coat changes that will indicate that there's an underlying problem, a myofascial problem in that region. And I was like, jog on, no way. And to really eat my words, because Julia told me that you might find that the coat won't shed very well. You might find that it will clump. You might find that the coat pattern will change. You might find that you'll have dandruff in that region where there hasn't been good blood flow circulating into that subcutis that's nourishing the hair follicles, allowing the sebum production, etc. I was like, no.
Rubbish.
So one day, one of my lovely clients, their dog, poor dog, was put to sleep, and they said, "Would you like to use?" He was called Rolo for dissection, and that was very generous of them. So me and Julia set to work one weekend at the practice when it was closed.
Rock and roll, eh, Hannah? Rock and roll.
Oh, I know. We have such exciting lives. And I was removing the skin for us to look at the underlying musculature and fascia, which we'll come into later. And there was an area of clumping of coat. And I can remember pretty much turning around going, "So, are we going to find a problem here, Julia?" And sure enough, everywhere else where the coat was lovely and smooth and glossy, the skin would peel away. So you'd scalpel incision, carefully cut, and it would peel away from the subcutaneous structures. This region, I could not get the skin off the underlying subcutaneous, the fat, the adipose tissue, the fascia, and the muscle. It was stuck like glue, and I had to use a sharp scalpel knife to try and peel it away. That was a eat my words moment, and I really learned a lesson there. So looking at coat changes, be it the colour, the health,
the lie, but it really is that that dead look of certain areas of coats, and if it's incongruous with the rest of the dog, then that is a real indicator. So you might have a really shiny head and neck and shoulders, but down over their back, they could have an area of dull coat. As you say, it can be a slight color change. I've seen chocolate Labradors go a very pale color. That is only an indicator. It might not be. I've seen a lot of collies and the fluffier haired dogs look very that dead coat look. Yeah, it is an indicator. Or they're just not shedding enough over that particular leg. Or
and I think I had it reinforced me. I was treating a dog for a back problem, but it also had quite a nasty kind of like dry seborrhea, which was like a really flaky dandruffy coat. And with the treatments, that actually went because of a lot of massage techniques are like myofascial. You're lifting the skin, you're skin rolling, you're increasing the blood flow. And the dog's skin really, really improved. So that kind of physical change of coats. Other physical changes, let's talk about feet, because this grates me. Now, when I'm doing ops or if I've got a dog on the table and I see the digits are going all different directions and they're overgrowth of the fibrillated pad on the side and it's really smooth on one side and then it's on the other side, you've got nails that are being worn badly. And I sit there going, if that were my feet, I don't think I would walk very well. You know, they're supposed to be digitigrade, they're supposed to be on the tiptoes.
Yeah.
What things do you see?
Yeah, I mean, again, absolutely. The feet, the nails, it reflects what's going on. And the thing is with dogs, in my experience, most of the instability starts around the shoulders or the pelvic region and goes down. So the feet tend to be, there are no rules here, but tend to reflect what's going on higher. So the classic are the very long front toenails where the dog is actually loading on the front because the back end, the pelvis region, for whatever region, or the back, the lower back, is loading forward. So what happens is that the wrists here hyperextend. So what happens very slightly? So the paws are lifted, so the nails grow more.
So what Julia's saying is so basically if they were like that, because they're loading through the wrist, they end up walking on the back of the pad, so the toenails aren't actually in contact with the ground, so they end up growing forward. It's very fascinating.
It really, the whole loading structure from there is awful, all the way through that wrist. That would be so uncomfortable, all the way into the elbow, into the shoulder, into the neck. So there's that classic one. There's of course,
and it's a vicious cycle, isn't it? Because you've got that bounces to cause pain, that bounces back and causes more discomfort on the source, and then that bounces back and causes exactly. It's just like it's nasty
across the body. And all the time, all it's doing is winding up, and the dog is basically getting shorter and shorter. And I think on that, it's quite interesting. And this is another interesting, so many interesting cases, but one in particular, one case I saw of a dog that had severe adaptive change issues, and we don't know quite where it was coming from, but basically her posture had changed dramatically. And so we started on a treatment program. But what was really interesting was I treated this dog late summer, and this is relevant, just because of course we look anyway. But I didn't see her again until the spring. And interestingly, when she came back in the spring, the owner said to me, she said the most fascinating thing was that the coat that she had bought for her the previous winter was 2 inches too short.
Oh, wow.
What looked like the dog's back had become 2 inches longer. That's what the sort of levels of compression when we're looking at adaptive.
And I think that was another key point in your teaching to me, was about the collar. And somebody has about how the collar size decreased. Now, I can relate to this in that I worked at a practice for about 6 months, and my stress levels were horrendous. And I would go to work like this, and by the end of the day, my shoulders would be up round by my ears, and they'd be there for all day. And I would actually have to physically push them back down. And I was getting backache and everything, neck ache, headaches, etc. And if you think about it, if you've got the weight forward and the shoulders are developing and the neck shortening, it's going to get thicker. So collars that are getting tighter is another thing for people to think about. The classic mane of the Labrador, we forget this. It's such a, oh my God, yes. They're born with this beautiful slick, they're like seals. And they're into lions, and they're really front end heavy, and loads of stuff. So posture, please don't overlook posture. So then finally we did touch on this and gait change. Now this is something that bugs me a little bit, because it's a bit like an ex-smoker. Now that I see what I know, I can't believe that I didn't see it and know it.
Though, can you? That's the problem.
No, now that you can see it, it's like, why didn't I see this before? And it makes so much sense. But as a vet, I've always waited for capability and gait change to signify that I have a problem. And I've generally waited for people to flag it up to me, because it's a difficult conversation to have. So take notes, all of you CAM followers. As the vet stood behind that table, I don't want to break bad news to you. I want you to come in, and I want it to be lovely, happy news. I like health checks where I can go, it's looking great, fantastic, your weight's fantastic, I need do nothing, I go. Don't know why I came into that accent, but I don't want to tell you that there is a problem. So when I have quite subtle changes and your face, I don't think so. What? He's got a bad back and that's causing the anal gland problems. No. When you have that kind of response from an owner, it's very, very hard to tackle these subtlety topics. So that's why we created the PDF, this lovely PDF CAM factor. Vets can use it as well. You guys, you can use it as well. If you're seeing things and you're hearing things and that owner's not listening to you, fill in the PDF. Let them take it home with them. Let them go and absorb it. Give them a link to this episode so that people can kind of go, okay, they're not trying to have me over a barrel. There is something going on here. But going to the tangent, I did wait for capability and gait changes. And now that I know what I know, I could have potentially picked up on something years earlier if I'd listened to behaviour change, posture change, and looked for the physical changes.
I honestly think the lameness or the gait change, the extreme gait change, is one of the last things to actually happen.
Yeah, I really do. And it's really sad because
it's sad.
We also get the big group of owners and pet professionals and stuff that say, oh, it's only a little limp. And I'm like, oh my gosh, do you know what's gone on before the little limp? This dog behavior change and posture change, and now he's got a little limp. But you know, this is the pinnacle. We've hit the top of the volcano now, guys. Yeah, there's stuff going down. So
Absolutely.
This might include competitive dogs that are not performing so well, so they may be pulling out of weaves, they might be avoiding jumps, they might not have the wish to do the A-frame, they might be in fear of the seesaw. These might be dogs that hesitate before doing flyball, they might be dogs that are underperforming when they're going out on, you know, a shoot, and they might hesitate before they want to get back into that vehicle. It's just I don't know if I'll make it, and that might be a problem. These might be dogs that now hesitate to get onto the sofa where they used to just fly on. Capability and gait change. Let's not just wait for over limping. Let's catch these earlier.
The other areas of capability, there are two that there's one in particular that I find fascinating, and I will reveal that in a minute. But one thing that we can all look out for too is stretching. When a dog gets up from sleep, a healthy animal should get up and stretch. And often people say, yeah, my dog stretches perfectly, but they're talking about just the front end stretching. The dog should stretch the front end and the back end, and they should be able to stretch evenly. And often they can only stretch the front and maybe a slight stretch of the back end, but not a full stretch. So that's another capability to observe.
And I think that one's lovely, because when you start improving their pain state, it's one of the first that kind of comes back, and it won't be a full stretch, but you'll see a dog go,
give it a go.
Hey, that didn't hurt. I'm going to go a bit further. Ooh.
But I think one of the biggest capability improvers that we like to see, or assessments that we are very keen, especially because we've been involved in quite a few studies and are continually going to be involved. And this is something that people have to photograph, is their dogs having a poo, and also having a pee. But having a poo makes it more gender neutral. Absolutely. So when every dog has a poo at least once a day, and how they position their body completely relates to how they feel in their physical state.
Yes.
Yeah. So they're going to shift differently. They might hold one leg up. They might extend their necks crazily far forward to try and counterbalance the back end. They might go into a complete U shape or upside down U shape. It's a fascinating area.
Julia introduced me to the poo-poo train, and I was, that was another one of me going,
but I don't think
so they can't actually hold a posture, so they parcel poo. So instead of one patch poo, it becomes the triple bag poo. And now I'm like, oh my God, this is a world I just didn't know about.
Yeah, a round baler. The round balers that bale the hay and the straw in the fields. They go down the fields and release a round bale, then go on and then release another. That's a common thing that we see in dogs, and I
think we've just actually revealed the level of maturity in me. I'm the poo-poo train and you're the round baler.
Yeah, it sounds much more sophisticated.
You're way more sophisticated than me. But yes, that capability and gait change. A lot of veterinary material references, walking, trotting, transitioning. I feel personally, trying to make this material more accessible for owners, we need to talk about pooing, sleeping, and the capabilities. And that's why, just a little kind of tangent, this is why I love client-specific outcome measures regarding objective monitoring. This is why I think that they are such a groundbreaking way for people to make sure that their interventions are working, be it massage, be it supplements, be it acupuncture.
And you definitely introduced me to those measurable outcomes. So I'm going to say that you helped instigate our comfort scale, which are 25 questions that we ask our clients and our study people as well, and they go from physical, static, behavioral, eating and digestion and other indicators.
Yeah.
And then we have a scale, and then we can look at percentage improvements, and I just think that was just brilliant when you were.
Well, I can't take credit for it because, as I say, we're impact champions, and client-specific outcome measures, that terminology is from Duncan Lascelles, who's over in America. But there are lots of people that are using it but don't have that terminology. So I mentioned to Julia before we were going to do this live that she started this journey for me, which I give her credit to. And then I met the likes of Gwen Covey-Crump, Sarah Heath, Sam Lindley, Claire Rusbridge, Sarah Fisher, all these people that just add another layer, but the fundamentals are very similar. So Sarah Fisher with the whole tutelage and looking at observation, looking at behavioural change, looking at the way that they carry themselves, looking for those indicators that dog's unwillingness to take on a new wanted behaviour could be because it actually doesn't want to, because it could be painful or something was painful. Amazing people. So I will write those names down, and you can go and follow my journey of meeting amazing people that just add another layer and another layer and another layer, and you start getting this better global picture. So we've done it's called the CAM factor, but you call it the comfort scale, just to iterate.
Yeah, well, the jigsaw is the same sort of concept as yours, but the comfort scale is something quite different, and it's
okay. Tell us about the comfort scale. And come closer, because you're disappearing.
Back to the oven?
Yeah, back to the oven.
Which way?
Back to mid. There you go.
There? Right.
Perfect.
So we call it comfort scale because to call it pain, for us, that sounds too diagnostic. So we prefer the name comfort. So we're looking at areas of comfort and discomfort. So as I said, we put it within 5 questions of physical. So for an example of one question in the physical side is, does your dog show signs of being stiff when they get up? So when they get up, can they not mobilize their legs well? It's the same as ours. So that's one. And another one we then put a category of static. So when dogs do things in movement, they can do things moving easier quite often than they can do them statically. So we've separated those two things out. So a static action could be something like propping their head or lying there with their head off a sofa. So that's sort of within static. Behavioral, we're looking at the licking, the chewing, the body
awareness, aversion to touch.
Then we have got an eating and digestion one, and that does cover the looking at the pooing, the anal glands, and how they position themselves when they urinate, and also chewing. We look a lot at dogs chewing because their chewing muscles here and here relate very much to the neck. And if the neck is overloaded and overworked, they will engage whatever they can to move. So these can become very, very tight and painful. And so they might actually stop chewing their favorite bone, and that's another behavior that can change. So that,
and I'm going to say that because this was a real shocker for me, because I would have, as a vet, just gone, well, there's something wrong in the mouth.
Exactly.
It's going to be an infected root. Yeah. There's going to be.
Teeth have always got to be looked at.
Yeah, but I think you really opened my eyes to the fact that there could be other reasons. And then I, with a heavy heart, kind of thought of all the dogs that I'd done a later in life dental, but they also had musculoskeletal disease, and I might have ended up doing a dental and it was just a scale and a polish, but there was nothing so drastic to explain the unwillingness to chew. And I sit there going, oh goodness, I wish I had known what I know now.
Yeah, but that's a learning journey.
It is a learning journey.
We all think back of what we knew then and how we did things, and we would want to have the benefit of our knowledge now.
Well, because we've been talking for nigh on an hour,
even with technical problems.
even with technical problems. Oh yeah, no, so it'd be 45 minutes. What I was going to do is try and get people to understand about fascia. Now, I'm hoping shortly before Christmas, Dr. Mike Petty, who is known as Dr. Pain in America, he has done a lot of work and a lot of lecturing about myofascial pain syndromes in animals. And I think this is going to be a really exciting topic for him to cover. But you can just touch on it for us. Just explain, because again, this was a massive, massive learning curve for me. Let's go back in time. So I went to university in 1996. My first year as a vet student, we did our anatomy. I wish we actually did it as the last thing now that I can look back and go, oh, I could have learned so much more. And I can remember at that time, we peeled the skin off the dog and they're like, get rid of this white stuff. You know, look at the muscles. Look at how the muscles interplay with each other, and pulley and lever system and nerves and veins and blood vessels and a batty professor. And that white stuff really didn't get the kudos that it's now getting, because this is amazing. Please tell.
Yeah. Okay, so put it simply, I think in the future our anatomy books are going to change from looking, as you've just said, from muscle to actually how the muscles interlink with each other and the problems that can cause. So, as you say, this white stuff called fascia was removed so we could look at the pure muscle bellies and their insertions and origins. So the way I think it's probably easier to understand it is we have to make continuous movement. We have not continuous movement, but joined up movement. And if it was just every muscle, it would be very jerky and it wouldn't be joined up. So something joins the whole movement. And basically that could be attributed to fascia. And we have these very well fascial trains now that connect different muscles together to form different movements. So we have fascia that joins this sort of plane and a rotational plane, so we can make different movements in a very joined up way. So it's almost like a bandaging system that's bandaged us together to make a whole, so we can make functional movement. Yeah. And I think the power of these muscle or these myofascial trains came to light just very few weeks ago for me, when I had the deepest pain in my right ankle, just above my ankle. And I thought it was some form of neural problem arising from my sciatic nerve, but it didn't feel like that. And it felt like there was a vice gripping my ankle. It was hideous. I could only stand up for a couple of minutes at a time without being in deep pain. So again, I go, great, I wonder what this is, because again, I could empathise with what a problem might be. So I went to the wonderful Sarah Dover McCarthy, who has
Sarah Dover McCarthy. She was on my list. I forgot to mention her. Sarah Dover McCarthy. Yes.
Sarah Dover McCarthy, who has kept my very broken body together. And I went to see her and she said, you've got really severe myofascial dysfunction arising from your left shoulder, which is always the left side of my neck, my shoulder. She treated me, and as she was treating me, the pain in my ankle was disappearing as she was treating me here. And 2-3 treatments later, perfect.
Well, this was for me what was really exciting about the whole introduction to fascia. So bear in mind, I've been at university for 6 years. I've been in practice about 10 years by this point, and fascia really hadn't ever come up. For all you guys that are going, what is she talking about? It's basically a kind of very fine connective tissue that covers everything. So we're not talking about it just coating a muscle belly. It coats everything down to myofiber. So the fractionest of the fraction of that muscle.
All the different densities.
The bones, it goes around your kidneys, it's around your liver. It's like this most beautiful spider's web that goes throughout all your body. And it is a communication pathway. So you have your blood system that carries your hormones, you have your nervous system that carries the electrical impulses, and you have your fascial system that carries like mechanical movement change, pressure change, etc. Now, I didn't get taught any of this at university. So when Julia said to me in my very, very first lesson, how do you know that your finger's above your head? And I was like, pardon? She was like, how do you know? And I was like, well, it'd be my nervous system. She's like, I didn't know it had GPS. And I was like, oh yeah, you know, there's got to be some amazing algorithm going on in my brain with all of these mechanoreceptors, all these receptors in my fascial system sending, I'm firing, and that algorithm then lets me know that my finger is pretty much above my head. So the fascial system is amazing. So my chance to big up another person I've met on my journey, and I can't exactly remember name, but there's a lovely lady over in Denmark that's doing lots and lots of work on fascial pathways. We're not allowed to say fascial trains because that's very much human.
Oh, is that protected?
It's protected, so we have to call them like fascial paths or something.
Sorry.
And she's spent about 10 years now dissecting the dog and finding these pathways. So there's the dorsal superficial, the deep superficial, there's the superficial dorsal, deep dorsal. There's all these pathways. I'm not doing her justice, but she now actually treats the pathway to cause the dog to kind of release. So instead of the hands on the area, she's looking at what fascial pathway, and she'll treat at the end of the pathway to elicit change. Now, this is getting a bit more complicated. We'll talk about it if you guys want to know about it in another Facebook Live. But I just wanted to bring fascia into our conversation because it fits very well with what Julia does, which is manual therapies. And I personally don't feel that they get enough recognition. And a lady very early in this chat said, I've been given some meds by my vet and they've told me there's nothing more I can do. No, there's a lot more we can do. And we need to, as vets, start realizing the potential with these other complementary therapies that can add to our treatment plan. And multidisciplinary teams is a real buzzword at the moment, mentioned by Andy Gardner. Please go back and look at my lovely interview with Andy Gardner. Multidisciplinary teams can be vet, therapist, it can be specialist, it can be physiotherapist, hydrotherapist, all coming together to do the best for that animal. And you really did open my eyes with manual therapies. So there you go.
Well, it was a mutual learning, I think.
I wound you up.
In a good way.
Drove you to despair.
No, not at all. It was a very lively training.
Yeah.
Always.
So for tonight, we're going to leave it there because we know that there is the potential that we could talk about so much. We thought we could do some case studies, etc. But we will never end a Facebook Live without doing our 10 top tips. And the 10 top tips will always be that Julia takes number 10, I do number 9. She does number 8, I do number 7, 6, 5. And these are aimed at owners. I can start with 10 and you can do 9. These are aimed at owners, no matter their financial capability, no matter their physical capabilities, no matter where in the world they are. Let's give people advice that can be really, really impactful for their dog's condition. So I'm going to start with number 10, and it always will be flooring.
Thank you for warning me.
I know, you're on the spot now.
I really am.
For me,
yes, go on.
Is slippery flooring. Everybody that owns a dog can do something about offering their dog traction. Repetitive strain injuries, fear of surfaces, tensing up when walking on surfaces, losing the back end because they've got proprioceptive deficits and weakness. Please listen carefully. This can be a game changer. You might find that your dog can come off heavy amounts of pain medication just by changing their flooring and giving them grip. So number 9 for you.
Number 9, allow your dog to sniff.
Oh, yes. And why?
Yeah. Sorry?
Why?
Why? Because A, it fulfills their head. It allows them to absorb their environment and explore their world. But also, as a lot of these things, if you are feeding the brain, you're feeding the body with good stuff. So sniffing, puts the dog in a lovely natural position that will naturally extend and decompress their back, will allow better movement. It is amazing.
Perfect. Number 8 for me is we've been talking about posture a lot, and me and my tight hip flexors, I find myself at work choosing postures that if I'm scanning, if I'm x-raying, if I'm doing anything, I'm choosing a posture that's more comfortable to be in for the period of time that I'm doing the activity that I need to do. Dogs need to be comfortable when they're eating and drinking. And if that means that you change the way that you feed them and you raise the bowl, that whole experience becomes more pleasurable. So do think about that. Around the feeding bowl, make sure there's a tractional surface so that their front feet aren't slipping around on the wet surfaces. Don't feed them large quantities of food. There's been 2 studies about feeding dogs, and one study did suggest that bloat could be linked to bolting food, eating large quantities. So if you're going to feed, do it in a slow feeder or feed in smaller quantities, around about point of the shoulder high. You don't need to buy expensive stuff. You can pile up a load of books and put a tractional surface around it. So for you, that's number 7.
That's number 7.
No, so 10, 9, 8, 7. Yes, you're number 7.
I'm 7. Yes, okay. Give your dog a pillow.
Oh!
Or a cushion. Obviously, as I always tell people, you've got to embroider their names, otherwise they won't use it. But apart from that, offer them one. Put them one in the bed. If they need it, then they can use it. Choice is everything.
Choice. I like that one. Number 6 for me is something that people can easily fulfill, is keep them warm. I've moved to Scotland and it's Baltic. And what happens when you get cold is you tense up. So like at the moment, I've got home, I haven't turned the fire on, so it's freezing in here. And I'm sat here and I can feel my back is tense and it's therefore aching. So by keeping them warm, keeping the musculature, the soft tissue warm, don't take them out for a run and then just go and have a coffee with your mate and let them get cold on the ground. Think ahead, keep them warm. So 10, 9.
Okay. All right. Is it number 5?
You're number 5.
Number 5. Okay. Number 5, I would say you really do not need to take your dogs for long walks.
Oh, yes.
You really don't. Dogs like us need stimulation. We need to be interested. So going on a sniffing expedition where you go just feet or yards or meters is perfect. Absolutely perfect. I'm not just talking about older dogs, arthritic dogs, all dogs. They need to explore, to give themselves mental stimulation. It's not just about physical, and they will be much more relaxed after it. There have been studies, not particularly scientific, but a lot of studies done on pulse and sniffing, and their pulse comes down and they relax.
Good one. Number 4 for me will relate to the fact that I've recently started mountain biking. And whilst I've been mountain biking at an epic centre called Glen up in Scotland, I'm watching all these people mountain biking with their amazing dogs. And I sit there and I feel like handing out business cards left, right and centre, because there's all these dogs careering down these mountain paths and they are not capable of doing so. Their posture's wrong, their physical stature's wrong, they're carrying problems. But because they want to be with you, and because they're excited and the buzz and the arousal, they'll keep going and they'll keep going and they'll keep going. If you choose to do things like that, please get your dog's physically health checked. You know, I actually am at the point that I feel like going up and giving my Saturdays and being there and saying, I will physically assess your dog, because it's quite heartbreaking to see these dogs, you know, going on these really quite intense activities. And I can see that they've got postural adaptation, physical adaptation, and it's not being seen. So get your dog health checked. Number 3.
Okay. Please don't throw balls.
Yeah, I didn't tell you to say that. Yes.
Please don't. Just please don't. The moment a dog has been introduced to that, there's just a change that comes in them, and then you develop these repetitive strains because of a repetitive action. It's a massive, massive thing. Please don't. Play hide and seek. Much better for them. Hide something for them to find.
Yeah.
Then interaction between the two of you, they will be so, again, back to the scenting, calm, relaxed, stimulated. That is so fulfilling. Chasing a ball gets all the wrong hormones going, can make a dog into a different personality. I'm not a behaviorist, but look down the behavioral side of that. And on a physical scale, it breaks them. It really does. On a repetitive.
And so for the people that do sporting activities that involve a ball, like, you know, we don't want to say stop, you're bad people. It's not that at all.
No,
if your dog is doing a sport that requires that level of arousal, that level of drive to compete at that level, then get them physically health checked on a regular basis. I know some people that are doing high-end agility, and it is in their routine. 2 or 3 times a year, they will go and see a therapist or a vet that's got a special interest, who will feel them top to toe looking for signs that they are accommodating discomfort, they're adapting posture, etc. Doesn't mean you can still do these things, but be aware of what that ball and that drive is capable of. So we're not fun please.
No, not at all.
It's just be aware that is such, and I'll get Kathy Murphy to come back and talk about it, but it's such a primitive, a drive, you know, brain flush of all senses gone out of the window and ball. So number 2 for me is be careful of the little stuff. You know, I really do think that all of the little things can add up to make a big difference. So jumping in and out of cars, and your husband like, no, we've got the Freelander and it's a black Labrador. That's what they do in the movies. They jump out of the back of the Freelander and that's how they look. And that's no. All of these heavy impact forces, especially if they've been, you know, in the landy for a period of time, or in the back of the car for a long journey, and everything's a bit seized up and their coordination's a bit defunct and the muscles are not really on it, and then you ask them to jump from there. That's like me having been asleep for 6 hours, then jumping down from a 6-foot wall. Am I going to hurt myself? Yeah, I am. So those little things can make a really, really big difference. And Julia, number 1.
Okay, so having been put on the spot, I've been trying to look calm while I've been thinking of top tips. I think the one thing that it's not necessarily the most important, but it most certainly is up there, is the equipment you use.
Yeah.
It's not the equipment, it's how it's used. So it's not the fact that you use a collar, it's how you use the collar. Not the fact of the harness, it's how you use the harness. But however, I do want to just go on a little bit more on the harness side of things. Just make sure it fits properly, that it's not tight under the arm. Can you imagine having something rubbing under your arm every time you move? The other thing is make sure it fits, so it's not, when you put a little bit of pressure, it doesn't dig in here. Otherwise, you're going to do so much harm. Make sure it sits on the chest, and make sure it just sits further down the back. So be careful about harness fittings. Think about the rub points and how that would feel if your shirt or whatever was too tight on your neck, or, as I said, rubbing under your arm or wherever it might be. And likewise, if you have got a dog with a problem and you put a harness on them, be careful where you put the identity disc if you do put it on the harness, or the lead attachment, because it could knock on their back, which would be so uncomfortable.
Oh yeah, no, that's a really, really good point. And I think, again, give credit to Gwen for this. I think once you have pain, you have a switch in your head go off and go, that wouldn't be tolerable by me. I don't think it should be fair for them to tolerate it either. And I know that it's back to that empathy. We're allowed to do it. So thank you so much, Julia. I love you to bits, even though you ruined my life.
Well, as I said earlier, if I've done that, if I've ruined your life, but I hope I haven't, but you've created CAM, I'm in awe of you for doing it. It's a massive thing, and
It's going to get bigger. It's going to get better.
Sorry?
I've got a really amazing team now.
I know.
I'm just about to sit down and do a conference call with Dawn, who is an absolute legend on the CAM team. We're going to get bigger and we're going to get better. And the only way we're going to do that is if the CAM followers keep spreading the word, your dog more years. Let's really get the message out there, because I know that every dog owner I meet would like their dog for as long as possible and happy as possible.
Yeah.
And it's generally because they don't understand, or we've not spoken in their language, or we haven't been there soon enough to give them that essential advice, that they don't get that. So why?
I'm actually writing a puppy book as we speak.
Yes. Are you writing it out?
Not quite now, but actually now, yeah. Actually today.
I don't know how you do it. Where do you find the time?
I don't.
No.
Look at me. I'm only 22.
I know, I need a facelift. Right. So thank you very much, CAM followers. I'm going to be here on Thursday with the lovely Jade Stat from Street Vet, who I've got a huge amount of respect for. And she does a lot of work with arthritic dogs on the street. So that episode is going to be very practical, because we're not talking about huge amounts of money. We're not talking about, complicated diagnostics. These are really foundational, important things that we can put in place to help these low-income cases. So we will see you Thursday. Remember, spread the word, get yourself a beanie, get a snood, get the words out there, buy some business cards, hand them out, take them to your vets. Let's do this. Thanks, Julia. See you later, guys.
Bye. Bye-bye.
Cool.